As part of my series on my blog, I was doing some thinking about what would be a good topic, and this is actually going to be part of my consultation series in terms of getting your expectations correct. What I'm going to talk more specifically about is the person that comes in for corrective surgery or corrective work. They've had a bad procedure, a bad outcome at another place, and they're seeking advice from me on how to rectify the situation or at least improve upon it. I really divide this into two types: the person that truly has a problem and those that think they have a problem. I'm going to focus more specifically about the person that thinks they have a problem, and it may not be as great as that person esteems. Now, why am I going to talk about this? Am I belittling your thoughts? No, I'm helping you. I'm helping you not waste more of your money, not help you come in and just seek more advice to help you. Let me frame this discussion by telling some stories, because stories are a way for you to relate to this and understand it better, and then we're going to go ahead and talk about what these stories mean. I had a lady come to me and said she had a chin implant done in another city when she was living in that place and wasn't happy with it. So she sat down with me quite disconcerted and was very fearful, apprehensive. She had already seen three other plastic surgeons in Dallas, and she was looking for another consultation and how to correct her problem. So I looked at her, and I looked at her chin, and she said, "Don't you see it's uneven?" And I said, "I'm going to be very honest, I don't see it's being uneven. I'm a pretty good surgeon, I can see symmetry well, but I don't see it's uneven." And then she said, "Oh, okay. I thought the other plastic surgeons had seen this asymmetry." I said, "Let me ask you a question. What was your relationship with your previous surgeon?" She said, "Not a good one." I said, "Are you still living in the past? Are you trying to get back at your surgeon? Or is some of the motivation here the fact that your relationship was bad?" And she sort of hesitated for a moment, thought about it, and really disclosed that was the issue. So I thought, well, here you are. The surgeon probably has forgotten who you are, but you're trying to do a procedure that's going to cost you money, take risk unnecessarily, in my opinion, and I could worsen the situation for something I don't even see as a problem to begin with. Is that correct? And she thought about it, and I don't think that's probably the best idea. I had another gentleman, this is interesting, with a chin implant, and he was interested in talking about his chin. So I said, "Okay, come in and talk about chin." I looked at him, and his chin looked fine. I said, you don't need a chin implant. I think everything looks fine." And then he said, "Okay," and he took out of his pocket a chin implant. I said, "What are you doing carrying this chin implant around?" He says, "Well, I had a terrible experience. I had a chin implant that I didn't need, and I didn't think I needed, and here's my chin implant, and doctor, do you think I should have something done for my chin?" I said, "No, your chin looks fine. We don't need to do any surgery. In fact, what you need to do is take that physical baggage that you're carrying with you and discard it, please. Throw it away. It was a remnant of the past." And I'm going to talk about more what that means in a moment. I had another lady that came to me from out of state, and she had a burn injury in the past. It was about a year or two ago. And she was very fretful, very apprehensive about this, and some of the email photos that I received showed me the initial injury. I thought that was a current day. I'm thinking, boy, I've got to fix something not so good. But actually, when I saw her with the makeup on, I couldn't tell what she was talking about. So she went and took off the makeup. I looked at it and I said, "Well, your nose is a little bit red. I see a little tiny bit of a bump. But what is your problem?" She says, "Well, these areas here." I said, "Oh." And she said, "And it's upsetting my family." I said, "I hate to tell you this. Most likely the reason your family's upset is because you're upset. Because you go to your family with this fearful attitude that I had this terrible thing done, it's ruined my life, and now you're so focused that, oh my God, I must look bad, that your family is acting to the fact that you're acting unusual and weird and fearful and angry and really all of those things combined." So interestingly enough, the only deformity that was truly visible at a social distance was what the plastic surgeon was doing to try to fix the original problem. So I said, look, I could actually dissolve some of the product, knock down some of the redness with a vascular laser, but essentially what I was doing was bringing her further and further into her past. I'll say one thing about the past is we can't change the past, but we can learn from it. I think it's a problem if we constantly dwell in our past, and that is something that you have the freedom to escape. When you come in for consultation with me, what you're expecting is my experienced eye to tell you, would I help you? As a counterpoint, I had a lady that came to me referred from a friend who had 17 eyelid operations to fix the first person's procedure. Now, I'm not an oculoplastic surgeon. I'm not here to go back and redo the eyelids. That's something that I'm going to send to a specialist that works with functional eyelid problems. But she had a large lump of fat. And I said, look, even though in my hands I've really not had to remove a lump of fat like that, I need you to be taken care of. This is a deformity where you and I sit down in a room and have a conversation. I can't help but look at that thing. That thing is a deformity. And I said, we've got to rectify it. So, and this is not a slight against the other doctor, as I said, not only are you as a patient human being, but we surgeons, hate to tell you, are human beings as well. So my goal is to rectify the situation, not to lay blame on it, but to correct the situation as best as I could. And so I took care of it and took out the fat, and it looks actually quite seamless at a week. I can't even see the incision line. But the goal is to understand we've got to mentally divide deformity from not deformity. And what you may think is a deformity oftentimes really is not. And what happens is that if you are so mentally ensconced in the past, there's nothing I can do to rectify the situation, because you're not going to accept anything less than 100%. You're going to walk down the street and you're going to look at the mirror, you're going to worry if someone's looking at you, you're going to act bizarre. You're living in your own hell that, I hate to say, wasn't created oftentimes by the previous plastic surgeon. It was created by you. And what I'm oftentimes here to help you with is an escape. I'm not here just to take your money. I'm not here just to go ahead and do a plastic surgical procedure for you because you asked me to. I'm not here just to say, look, this is a situation, let's do it, let's fix it. If it's fixable, I'll help you. If I can't do it, I'll send you to the right person. If it's something where I don't think socially has impacted you, I'm going to tell you that. Or let's say it is. Let's say there's a little stigma, a little badge that's left over. Well, is it worth pursuing it? Sometimes we spiral ourselves psychologically deeper and deeper into a past that we can't fix. I always say, Linda, who's my spa director, came and says, Dr. Lamb, you're 99% right about everything. I said, well, I'm glad you feel that way. I'm happy you think of me that way. But maybe I'm 70% right. The difference is when I make a mistake in leadership in the office, I don't make that mistake twice. You know, and that's important as we learn from our past, but we live in our present and we look forward to the future. So when you come into me for a consultation for a corrective procedure, you need to really remember this. And after I've done the consultation with you, if you fall into the department where, in fact, maybe it's not quite a deformity to the level that you need to spend more money, more time, more emotional burden, I'm going to let you know that, and I'm going to have you watch this video one more time. So hopefully that was a good video just to give you a good overview of how I see a deformity, and especially corrective plastic surgery, and how to get you out of your past.